Hello and welcome to the Clinical Canvas, Stories from Seasoned Doctors.
This is a podcast series where we share our physician journeys in healthcare.
And we share today is limited to our own opinions and do not reflect those of our employer or any other institution.
I'm Dr. Seema Pendarkar with Internal Medicine.
I'm Dr. Jenny Castillo with Emergency Medicine.
And today in episode 2, we are going to be exploring Dr. Castillo's journey as an emergency medicine physician a little more.
So, I've been an emergency medicine physician for 26 years now. I graduated residency in 2004. So started residency in 2000. Yeah, I didn't think I was going to be an emergency medicine physician. I thought I was going to be a pediatrician. But I decided to do a rotation at the end of my third year in medical school. And it kind of changed my idea. It actually was hard to get an emergency medicine rotation as a third year because nobody wanted a medical student in the emergency room because things move so fast and, it's hard. So I kind of had to push for it and I was glad I did because that's, what I end up doing.
Tell us a little bit about sort of the beginning of your career as an emergency doc and what you went through and how it was.
Sure. I did residency in New York City Public Hospital, which was very, very different than where I grew up, which was a South Central Pennsylvania, very quiet. So it was kind of like a leap into the deep end in the emergency medicine world. I learned a lot. From residency, I went to another New York City public hospital for my first job. I was there about 5 years, and that was definitely a big learning curve in terms of clinical work, understanding culture of emergency medicine, understanding the culture of the community that I was serving. It was a big eye-opening experience, both from a perspective of medicine, but also perspective of life. I didn't realize the depth of what the emergency room brings together. I mean, you have people who are living in a community that's been marginalized and they don't have a lot, and there's a lot of anger, and that translated to the emergency room. And I just never really thought that that was the case. I always thought going into emergency room, you're there for, something that's really potentially intense medical problem. You would defer to the physician or you would defer to the medical professional. That was not the case in the emergency room when I first worked.
So it sounds like you're saying that on top of the acute medical issue, there were a lot of other social issues, maybe that you possibly were expected to address, or how did you get through that?
Absolutely. We definitely had to address it. It was not something that it was completely intertwined, completely connected. And, this was mid 2000s and there was still a lot of people with full-blown AIDS, that were coming to the emergency room, not on antiviral medications because they didn't have access to it. They didn't have the money for it. There was a lot of, like I can remember one of the most intense trauma situations I was in was a homeless guy who was living in the subways, and the hospital that I worked at was literally at there was a subway stop right in front of the hospital, and EMS brought the patient, straight up. They had been run over by a subway train, and it ran over his arm and his leg, and it was incredibly intense. And it was wintertime, so he was completely covered with lots of clothes that he was basically probably. That was the only clothes that he actually had. So we had to cut off all that clothes. It was, you really get into the real understanding of the community.
Did that add sort of another layer that made it difficult for you as a physician to sort of go into these shifts every day, or how did you work through that?
Yeah, I mean, it definitely had times because, it wasn't just the medicine that you had to deal with. And you understood that patients can get very angry. They can yell and scream at you and curse at you. And unfortunately, there was many times I actually had to call my my husband to come get me and meet me outside of the hospital because someone would literally say, I know when you get off, I'm going to be out there waiting for you.
Oh, that's so sad.
And so just that in addition to learning medicine. It was hard. It was very, very hard. Incredibly rewarding in many ways, but also very, very hard.
Yeah. So walk us through sort of how your career unfolded. It sounds like in the beginning you were working in some different emergency rooms. And then how about after that? What were the next phases?
So I went from that hospital to I went to a community hospital, which was very different. This was a hospital still in the New York City area, but I was the only physician on overnight from 2 a.m. I think it was 2 a.m. to 7 a.m. or was it 12 to 7? So for a period of time, I was the only emergency medicine physician there. There was no residents. There was, no other providers, no nurse practitioners.
Oh, wow.
I was solo. And that was a
For a
big,
12-hour shift?
that would be for about a 7 hour part
Okay. Got it.
of the shift. So part of the shift, there was two people, and then
Mhm.
one part of the shift was one person. That was completely different because you had to rely on yourself. There was no one there
Yeah.
to ask questions, throw, bounce ideas off of. And so that was a very different environment. And what I learned from that perspective is, unfortunately, it was not terribly supportive for women. And, at that time I was pregnant with my second child, and I understood from the perspective of scheduling, like, oh, well, Dr. Castillo is going to be off for 3 months or however long, needed for postpartum. And it was not, I felt it. I felt the pressure to get back, even though I actually had to stay out for 4 months. And also, there wasn't a lot of support from the hospital administration because our emergency department, the physicians of the emergency department were hired as a group into the hospital, and the hospital administration, there was not a lot of support. So at that point, between those different things, I decided to move to a kind of combination of community hospital and academic setting.
Okay.
So it was a hospital that was loosely affiliated with the university. They had residents, but for surgery and internal medicine only, but no emergency medicine residents. So it's quasi-academic, So at that point, I actually really hit, this was probably about 10 to 12 years into my career. I hit a real burnout phase.
That sounds like a real challenge, having to go through such a physically strenuous process of pregnancy while you're in a community hospital. It sounds like not a lot of support. And on top of that, just sort of difficulties of being an ER physician. It seems so much trauma and
it's very demanding physically and mentally. And I didn't understand that very well, definitely in the first half, even first 3/4 of my career, because I really thought that, I just had to be strong. I had to, power through, not feel like, the impact of the patients that we see. And instead, what that did was I just was carrying all that weight around, and it made it every shift even harder because I was not just going in and being a doctor for that day. I was carrying the 5 years before into that shift.
Yeah, yeah. Tell us a little more how you sort of got to the point where you were able to think about your own health and how you're feeling and how that related to the trajectory of your career, because I think that's so empowering. I've heard your story before.
So yeah, I actually, at this hospital that was the quasi-academic community hospital, I found myself walking into my shifts and envying the housekeeping staff. And because all they had to do, in my head, was to like mop the floor, clean the bathroom. They didn't have the weight of someone's life potentially on your shoulders. And I was like, oh my gosh, that's such why is this thought coming into my head? I worked so hard to get to this point, a lot of schooling, training, I have student loans to pay back, I can't like just walk away from this.
Right.
But I knew I wasn't feeling so great. So going into each shift, I just needed more and more time to recover between those shifts.
Right.
And I didn't have that because I was working full time. I realized that I liked teaching. So I decided to do a faculty scholars program that lasted for like a whole year. Every other week, we would get together to learn how to teach adult learners. And it was very interesting. I really enjoyed it. At the end, we had to do a project that I ended up using simulation education for, which was relatively-ish new at the time. And realized that I really enjoyed simulation education and how it also brought out the creativity in me and that I could create stories and create cases for people to like experience. So it's kind of like writing a script, like a movie script or a TV script and then having people act it out. So I really kind of like that using that creative side of me. And so that really spurred me on. And that actually led to my last position most recent position in the hospital of medicine. And that was an academic, big academic center, full on, research, writing papers. I went there initially for simulation education for the residents and then transitioned to being the director of well-being for the emergency department because I saw how my colleagues were just so drained. And I felt like there was something that needed to be addressed and done about it. So I put my name in the hat and I created the first well-being program in that institution, not just within the emergency department. Then we scaled it out to the rest of the institution. And that was a great, very difficult challenge, but it was a great experience. But given that, like you, it was not just that could have been a full-time job, right? Being the director of well-being.
Yes.
Instead, that was part of my job because I still had to work clinically. Still had to work the shifts, the days, the evenings, the nights, the weekends. I still had, then I would have meetings during the week. So there was many weeks that I didn't have a day off because I wanted to participate in and do this project that I felt really passionate about.
Right.
However, there wasn't the space to do it separately, right? So I had to cram more into a same amount of time.
Right.
So it just kind of, though it fed my creativity, it fed my passion, it took more of a toll on me because I had to do two jobs.
More and more.
Right.
Yeah.
Exactly.
Right.
Exactly.
Interesting. But I guess you were at least acknowledging the importance of wellness. We just weren't applying it to yourself, maybe.
I tried, but I realized that, then the pandemic hit. And so that took it to another level, especially in emergency medicine, because being in Manhattan during COVID, we got hit super hard. And I worked every day for 6 months straight. So at that point, I realized that all of this years of me carrying the cases and the stories and the heaviness, it just became too much. So I had to pull back.
Okay. And it seems like there's a lot of physicians I've talked with that sort of hit their rock bottom after the pandemic, because they kept going and going. And then the pandemic really put them in a place where they couldn't sustain that.
Yes, absolutely. Yes. I worked all through the pandemic. I did take a sabbatical. Well, not sabbatical. I couldn't even call it sabbatical. I took a quote unquote leave of absence. I basically, I got to the point where I was dreaming about patients, as far as the eye could see.
After the pandemic?
This was during July 2020.
Got it.
So after about 6 months of working straight, I just couldn't, I couldn't turn it off.
Right.
And my husband recognized, he was in the military, recognized what I was going through. And he said, you need to have a break. So I took 2 months off, did a lot of therapy, got on some medication and helped to kind of calm my, I just couldn't get out of that cycle of anxiety, and that definitely helped. And so I went back to work and worked for 2 more years. And then I decided that I needed to have a change.
Right. And you had some special circumstances, I think, during the pandemic that maybe influenced you to think about wellness in a different way?
Oh, absolutely. So I was the director of wellness through the pandemic. So we would actually help we set up a situation where every week with a psychiatrist, a psychologist, and me, we would have a virtual session for any provider who wanted to just join and just talk about their experience, because people found it very hard to talk to the family about it, talk to their friends, because at that time there was so much fear around it. And just being able to talk to another provider that's going through the same thing was people found very healing. And then unfortunately, a friend of mine, Dr. Lorna Breen, she committed suicide during that time. And she was, we were working together in the same, emergency room. And that was really, really impactful in terms of the way I saw how I was working in emergency medicine, and what it meant to me and my family. And that, I did not want to get to the point where I was going to be hurting myself or being such in a low point. And so I think in some ways, Lorna's suicide was actually instrumental in waking me up.
Right. I'm so sorry. And that must have been really challenging to deal with.
It was, but it's, I'm forever grateful for her, because, I was able to see what I needed to do for myself.
Right. So then I think that if you could take us through the next few steps, because it sounds like after that you sort of evolved your kind of way of working and thinking about your wellness in regards to being a doctor.
So after I did walk away from that highly, sought after academic job, the job that, everybody, wanted to get. And I was, thriving at it, like I was making my way up the ladder, and I didn't work clinically for a whole year. I just took time. I really just pulled back, started to connect with my body again. I learned Qigong, and which is a kind of a movement meditation, and allowed me to really connect back to a body that I didn't realize I was not connected with.
Yeah.
And a year into it, my husband's like, "Well, you need to start making some money again." So I went back to working urgent care part-time. And so I'm doing that clinically. Have done that for a couple years now, and then kind of doing some other odd jobs like writing for journals, doing a little bit of law work, kind of putting things together, which I actually find works well for me, in the sense that, maybe because I love emergency medicine, and I'm that type of person that constantly needs something new to stimulate and something new to challenge me. Once I work a clinical shift at the urgent care center, I'm like, okay, I'm done with clinical. Next day I get to do writing and sit at a desk and do something more creative with the other side of my brain. And so it keeps me engaged, constantly having a couple different things put together, as opposed to having a one career type of journey.
Right.
It took me, I don't remember, 20 some years to figure that out. So
better late than never.
yes, exactly. So
and it seems like a lot of people, as they progress in their clinical career, they sort of add on different things, I think, to prevent sort of the burnout and to be a little more balanced. So that's
right. I think
as well.
But the thing is, what I did was I kept adding, but I never subtracted it.
Yeah. Yes.
And that was the problem. Yes, I really did enjoy the education part, but I didn't pull back on other things.
Right.
In order to have that be more prominent in my life.
Right.
And I really enjoyed the well-being environment in the community, and what we were trying to accomplish there. But again, I wasn't pulling back on what other aspects to allow that to really kind of blossom. And so if that's anything I could tell someone, was like, yes, if you find something that you're really interested in, make sure you pull back on something else, so that you're not just keep adding up and you're not subtracting stuff.
That's great advice. And then I would say it seems like today the clinical climate in emergency medicine is a lot different. I think especially after the pandemic, I know that certain programs have had a hard time filling those spots. I mean, do you have any opinions on that? It seems like you still do enjoy that type of practice, but
You do. I mean, I don't think it's a concern about exposure and risk to you in your body. I don't get that sense. Anybody going to emergency medicine, that's not really a high concern for them. But it does take a whole new, it's a very demanding job. And it's realistically not something that you can just do for your whole career.
Right. Right.
You know, only working clinical. There are people who work, you know, there are nocturnists that work, you know, the 3 nights overnight for the whole, like, overnights were not for me. So
Yeah.
I can't do that. You know, that they have more leverage in the sense that if you are a nocturnist and want to only work nights, then you can kind of set your schedule. So you have a little bit more control over it. That's because they, you know, want people to try to be attracted to working overnight because a lot of people don't.
Right.
So that's one of the ways that they try to attract people to do it.
Right.
However, it is flexible, but you have to kind of understand, kind of like what you were saying in the first episode, you have to understand who you are,
Yeah.
what your priorities are, what your values are, what you are, how it works for your life,
Right.
and not just kind of go along with the pathway that you hear other people are doing or what you are expected to do or
Yes.
going down that pathway. It has to be your pathway. It has to be the
Exactly.
pathway that works for you within your family, within your life, with your what you're interested in.
Yeah, definitely. I think going against the grain, I think sometimes can be a good thing, and really following what makes sense for you is great.
That never crossed my mind. I always jumped through the hoops. Okay, well, this is, you know, I had to do this,
Yeah.
this hoop, then this hoop, and then this hoop. I knew I was going to be doing this path, and I was on that path. I was well on that path.
Yeah.
And then I finally woke up and I was like, oh, this is not the path that works for me.
Right. Right.
This is not how I want to live my life.
Right. Right.
And then at first I thought, well, I'm going to have to just quit medicine.
Mm-hmm.
But you don't have to quit medicine.
Yeah.
You know, my husband has this joke that he always says is that they will pay doctors to do anything.
Yeah.
And in my head, I never felt that. Or in my heart, I never felt that. I knew
Right.
intellectually that,
Right.
yes, they will pay doctors to do a lot of different things.
Yes.
But I always felt like, wait, I just have to do this one thing.
Right. Yeah.
And that's not the case. It's not the case.
And I think a lot of people just get trained into that mindset and they have the blinders on because we're all sort of told that we should do things in a certain way, right?
Oh, absolutely. I mean, there's a very narrow path. Medicine is very, very narrow in order to get to a certain level.
Right.
But it doesn't have to be that way.
Right.
There can be variations, there can be differences. You just have to be open to realizing it.
Yeah. So thanks so much for sharing all those interesting, pathways that you've been on. Do you have like your top 3 learning points that you would share based on your experiences so far?
Well, I would say do it your own way.
Mm-hmm.
Don't just stick to the pathway and do what you think everybody else is doing or what you think is expected of you.
Right.
Do it the way for your own pathway. Understanding emergency medicine is very difficult physically, mentally, and having things to offset that from the beginning. Whatever works for you in terms of de-stressing or combating stress, have those set from the beginning.
Mm-hmm.
And really enjoy the fact that you are being part of someone's really intense moments,
Mm-hmm.
you know, medically, emotionally. I mean, you get to see the full gamut of humanity in emergency room. And it's amazing. It's an amazing experience.
Right. Awesome. Well, any other final concluding thoughts?
Well, thank you very much. And I hope this was helpful.
Take care. We'll see you on the next episode.
Take care. Bye-bye.